Hi everybody, I'm Dr. Bryton Mansfield. This is Tooth Tip Tuesday, and we've got an exciting one for you. We're talking about dental materials. I know all of you dental nerds out there are just pumped, but actually quite practical for those of you that are interested in learning about different crown materials. So we get a lot of patients that come in and still look at us and go, do I have to get a gold crown even though it's a front tooth? And believe it or not, no, you don't. We actually have tooth-colored crowns nowadays. So I just want to review a couple of them with you, the primary ones that we use, as well as some other common ones out there. So first things first, we have what are called porcelain fused to metal crowns. They've been around for a very long time. They're very successful. Essentially, it's a metal substructure with porcelain on the outside that looks tooth-colored. It's strong, looks like a tooth, works really well. And they're very common and commonly seen in practices, and they're still very much used. From there, we have a couple other things that we use. In particular, there are two things. One is called an all zirconia crown, which is a very strong material. To date, it is considered kind of the replacement for gold because it's just as strong as gold, but also tooth colored. But we tend to use those more in the back teeth because they don't always have the greatest appearance. But they're strong enough that actually for years they were used in hip replacements. And if anybody knows anything about hip replacements, you got to bear a lot of weight down there. And so for them to be able to be used in the mouth, you know it's really strong. From there, we have what are called lithium disilicates, or in particular, there's a brand called Emax, which has pretty much set the tone for what a really good lithium disilicate works and looks like. And so I've got some examples here for you. I'm going to show you some really cool things, but in particular, we'll start with the lithium disilicates or the Emax, and I'll show you what they look like. So we mill all of ours in office, so we do a digital scan, design it, and make it all in office. You go home same day with that particular crown. But it starts in a little block that looks somewhat like this. It's purple. Yes, you don't go home with a purple tooth. Once we design it and cut it out of there, we'll then put it into an oven that will sinter it and bring out its color. And we can also shade it and make it look nice and natural. And so that's our lithium disilicate Emax that we use typically on front teeth. And then from there, we also have our zirconias. These ones are kind of neat. They come in a much bigger block. And it's almost like a chalk material. If I drop this, it actually has a degree of like a powder where it will break apart like a chalk. But same thing, we'll mill these out. And they'll come through almost like in a chalk phase. What's really cool about this, though, is when it gets sintered or put in the oven will bring out its strength. And it makes the whole thing shrink. And in doing so, it makes it stronger. And so those are our main crowns that we use. Gold still gets used and it still works very well. But in particular, we like to go with the tooth colored ones. Most patients prefer that. But we have gold, we have porcelain fused to metal. In particular, we use the zirconia and the lithium disilicate or Emax. So for those of you that were interested, hopefully this is helpful. If you ever have questions, feel free to give us a phone call. As always, like us, share it if you think it'll be helpful for anybody else. Thanks so much. Hope you have a great rest of your week.